What hurts?
My hip hurts right here.
Do you know how this happened?
No, not really. It just started hurting after practice one day.
What kind of pain do you have?
It feels really tight when I run or jump.
What is your intensity of pain on a scale from 1 to 10, 10 being you need to be in the hospital?
Probably a 4.
Is there any disability you have from this injury, like you can't walk on a leg or you limp?
Sometimes it hurts to walk a little.
Have you had any prior injury to the thigh or hip area?
No.
Comparing bilaterally, I don't see any differences in your legs. I can tell it's tight to move and you're not willing to move it very often. I can see that you're in slight pain when you walk. I don't see any deformity or swelling. And I can tell that you're favoring the unaffected side. And I don't see any surgical scars.
You're right.
Medial femoral condyle, lateral femoral condyle, greater trochanter, ASIS, iliac crest. Sartorius, gracilis, adductors, IT band, rectus femoris, vastus medialis, vastus lateralis, gluteus medius, gluteus maximus, semitendinosus, bicep femoris, semimembranosus.
Now we are going to do some special tests. We're going to start with the Faber test. Faber tests flexion, abduction, and external rotation. Pain may be felt in the hip or on the S-side joint if this test is positive. You take the foot with the painful side and place it on the opposite knee and push down on the knee. If there's pain in the SI joint, then the test is positive. Next, we are going to do the Noble's test. Athlete lays supine, knee is flexed to 90 degrees. Pressure is applied to the lateral femoral epicondyle while the knee is gradually extended. A positive test is when severe pain is felt on the lateral femoral, and this test for IT band tightness. Next, we are going to do the Ober's test. The athlete lays on the affected side on the edge of the treatment table. The top leg is bent at a 90-degree angle and abducted as far as possible. First, you would stabilize the pelvis, and the abducted thigh is then relaxed and allowed to drop into abduction and extension. If the thigh remains in the abducted position, then this is positive for IT band tightness. Okay. You can lay back again. Next, we are going to do the Gansler's test. Then you're going to have the athlete hold their affected leg and have the other leg hanging off the table and push the leg into abduction. Next, we are going to be doing the Trendelenburg test. First, the athlete is going to stand and lift their unaffected leg into the air. The unaffected hip should be higher than the affected hip. If the affected hip is raised higher, then there is weakness in the hip abductor.
Next, we are going to do the Thompson's test. The athlete will lay on their back with their hands across their chest and their legs fully extended. I will place one hand under their back and they will bring their leg to their chest. And the extended thigh should be flat on the table, but if it lifts up, then that means that there is a tight hip flexor.